This is me, Vijita, Nurse Instructor at Adina Coaching Center. I am going to discuss questions from oncology. So this is the first question. Adult experience severe vomiting from cancer chemotherapy drug. Which acid-base imbalance should be the nurse anticipate? Okay, so what's the meaning of the question? Patient is receiving chemotherapeutic medications, and as we all know, the side effect of chemotherapeutic medications are vomiting and nausea. That is the initial side effect, and not only this, there are other side effects also, but the main initial side effect is nausea and vomiting. So, which acid-base imbalance should be the nurse anticipate? So, vomiting causes which acid-base imbalance? So, we will remove the wrong answer from this. So, which one is considered as a wrong answer in this? See, ketoacidosis is the sign of diabetes, uncontrolled diabetes. So, you can remove option A, and respiratory alkalosis can also be removed. So, there are two wrong answers. Ketoacidosis and respiratory alkalosis. So, what is the correct answer from this? Metabolic acidosis, and that is metabolic alkalosis. Always remember, vomiting causes metabolic alkalosis rather than acidosis. Diarrhea causes metabolic acidosis. So, please write down in your book. Diarrhea causes metabolic acidosis. Vomiting causes metabolic alkalosis. Vomiting, GI suction, continuous gastric aspirations. These are the situations where metabolic alkalosis is expected. Okay. Next question. A woman loses most of her hair as a result of cancer chemotherapy. The nurse understands that which of the following is true about chemotherapy-induced alopecia. And see, we said the initial side effect of chemotherapy is nausea and vomiting, and the later side effect of chemotherapy is alopecia, and because of alopecia, yes, the patient will be emotionally upset. Moody alopecia, yes, it always causes body image disturbances. So the patient asks the nurse regarding alopecia. So the nurse understands that which of the following is true about chemotherapy-induced alopecia. See, alopecia is only considered as a temporary changes. Okay, so this is only considered as a temporary changes. So you have to just remember that particular word. It is only a temporary changes. And when you stop the chemotherapeutic medications, the hair follicle will start to grow. Okay, so prathekam sradhikka, chemotherapy initial side effect aana nausea and vomiting, and the later side effect aayittu consider cheyavanna oru side effect or a complication aana alopecia. But alopecia is not a permanent one. It is only a temporary changes. So after 3 months of stopping chemotherapeutic medications, the hair follicle will start to grow. Okay. So what is the answer? Yes, third option. The hair loss is only a temporary changes. So see, we will try to read the entire options. First option is new hair will be grey. It is completely wrong. You can remove that. And avoid the use of wig. See, in order to gain normal body image, the patient need to wear a wig. Otherwise, wig illadirukumbol bhayangara disturbed aayirikkum. Avoid using wig is wrong. So you can avoid A and B. And the third already we said. And fourth is pre-chemo hair texture will return. Angane oru surety illa. Pre-chemo texture hair will return. Other surety. We cannot give a complete surety regarding this. So the correct answer for this question is C. Okay, so next question. Adult develop second degree or a second level skin reactions from radiation therapy. When evaluating his symptoms, which of the following would not be present? Okay, so radiation therapy, mainly radiations, there are two kinds of radiation. Internal radiation as well as external radiation. I repeat, internal radiation and external radiation. Okay, so radiation is considered as a choice of treatment of cancer. And how does this radiation work? Normally, radiation will act on the DNA, which is necessary for multiplication of cells. Okay, and it will not act on the cell wall. Okay, so radiation eppozhum act cheyyunnathu, it will act on the DNA, which is necessary for division. അതായത് ഒരു സെൽ റാപ്പിഡ് ആയിട്ട് വളരാൻ ആവശ്യമായിട്ടുള്ള DNA-യുടെ മേലിൽ ആക്ട് ചെയ്യുകയും എന്നിട്ട് സെല്ലിന്റെ കംപ്ലീറ്റ് ഡിവിഷൻ റെഡ്യൂസ് ചെയ്യുകയും ചെയ്യുകയാണ് radiation therapy. That is a goal, that is the action. Okay, but this will not act on the cell wall. Okay, radiation therapy rendu tharathilanuള്ളത്, internal radiation and external radiation. Okay, internal radiation nammal parayna oru perana brachytherapy. What is the other name of internal radiation? It's called as brachytherapy. What is the other name of external radiation? It is teletherapy. Fine. So internal radiation and external radiation തമ്മിലുള്ള main difference. External radiation എന്ന് പറയുന്നത് a radioactive isotope. For suppose if this is a radioactive isotope, this is kept outside the body, and from this ionizing radiation is coming like a alpha, gamma, beta. Okay, so mainly we use like beta and gamma rays. Okay, alpha rays normally not using, and mainly using the gamma rays or beta rays. So if this is a radioactive isotope and it is producing like ionizing radiations, when the ionizing radiation is coming out, so we will keep the patient's body over there, so the body will directly get affected with this radiation. So this is an external radiation. Radioactive isotope is kept external to the body, and from there the patient is getting radiation. Okay, so after this particular radiation or after this particular episode of radiation, once the radioactive isotope is maatiya, the patient will be completely all right. Okay, external radiation, where is this radioactive isotope? It is external to the body and the patient is getting radiation. But internal radiation endu sambhavikkunnathu, this particular internal this radioactive isotopes, or it is in the form of fluid, or it is in the form of tablets, pellets, seeds. Okay, ingane edengilum oru formula. So these radioactive isotopes, either it is available in the form of seed, pellets or a fluid, it is directly implanted. Either it is implanting in our body, or we are just swallowing this pellet, or just injecting into the bloodstream through IV. Okay, so internal radioactive isotope that is given into the body, or that is implanted inside the body. Okay, once it is implanted inside our body, this radioactive isotope will start to emit the radiation. So my body is also considered as radioactive, but mainly certain radiations, normally for internal radiation we use ionizing radiations. For those radioactive isotopes, or those ionizing radiations will not transfer or will not cross the skin. Okay, so we normally use like the particular thing, use in radio ionizing radiations, skin break ചെയ്തിട്ട് പുറത്തേക്ക് പോകാൻ പറ്റാത്ത തരത്തിലുള്ള റേഡിയേഷൻസ് ആണ് യൂസ് ചെയ്യുന്നത്. Okay, so if you can use like a beta or gamma type of radiations, we never use alpha radiations. So these radioactive isotopes are implanted inside to our body, and that may start radiating. So the internal body organs get exposed with that radiation, and that will mainly focus on the DNA, which is necessary for multiplying the cell. So please learn what is the action of radiation and what are the types of radiation. Okay, so out of this external radiation, the radioactive isotope which is kept outside the body, and from there the radiation is directly exposing to our body. So there will be chances to get a skin damage. That is what the question asks. Okay, question ഇവിടെ പറഞ്ഞിരിക്കുന്നത്, patient develops a second level skin reactions from a radiation therapy. When evaluating his symptoms, which of the following would not be present? ഏതാണ് ഇതിനകത്ത് കാണാത്തത് as a second level skin reaction ൽ കാണാത്തത് ഏതാണ്? Okay, see, scaly skin, itchy feeling and dry secumation, these are the signs which is associated with the second degree skin reaction. Okay, and reddening of skin is not included in this. So, which is not present in second level skin reaction, the answer is D, reddening of skin. Okay, അപ്പോൾ internal radiation ഉള്ള patients external radiation ഉള്ള patientsനും വരാവുന്ന side effects and what are the precautions that you need to follow, that is very very important. Okay, if you are preparing for any of international nursing licensing exam, you will get majority of questions from radiation as well as chemotherapy. Okay, അപ്പോൾ radiation receive ചെയ്യുന്ന patientsനെ എങ്ങനെ കെയർ ചെയ്യും? Okay, so that will be frequently asked. So ഞാൻ just ഒന്ന് revise ചെയ്യാം. External radiation receive ചെയ്യുന്ന patients ആണെങ്കിൽ you have to give more importance to skin care. Never wash the skin with a soap or never apply talcum powder or anything, deodorant or emollients, anything. Okay, so never apply any chemical thing on the skin. Okay, so that is a very important thing. Okay, and internal radiation receive ചെയ്യുന്ന patient ആണെങ്കിൽ the radioactive isotope is implanted inside our body, so this particular patient itself considered as radioactive, so that this particular patient should be admitted in a private room. Okay, അപ്പോൾ ഈ patient private room ൽ admit ചെയ്യുക. Okay, and then while caring the patient, whenever you enter into a patient's room, that means nurse, whenever the nurse is entering into patient's room, you have to wear lead apron. And please remember to wear dosimeter badge. See, when you wear dosimeter badge, it will calculate the exposure of radiation. Fine. Avoid visitors or limit visitors, and pregnant ladies and age less than 16 years are not permitted to enter into the patient's room. Okay, so the patient should be in a private room. Always the door should be closed. Keep a caution board so that it is like communicating the population or communicating the everyone, whoever is around the room, that നമ്മൾ communicate ചെയ്യാണ്. Inside that there is an radiation is going on, so no one should come in front of the room and the room should be always closed. If you want, you can select a room which is completely far from the nurse station or at the corner of the floor. Fine. Yes, we will go to next question. The nurse is teaching a client about signs of radiation-induced thrombocytopenia. Which symptoms will be included in the teaching? So the patient is receiving radiation and radiation-induced thrombocytopenia. What is thrombocytopenia? Low number of platelet. Okay, so thrombocytopenia is a term whereas platelet, the number of platelet is reduced. So which symptoms should be included in the teaching? So thrombocytopenia ulla oru patient ina nammal teach cheyyumbam allengil if you give education regarding thrombocytopenia, or if a patient has thrombocytopenia, if you give instructions regarding the signs and symptoms of thrombocytopenia, what is expected in this? Fine. See, normally when a patient is receiving radiation, there is a side effect of radiation like a skin irritation, nausea, vomiting and anorexia. There will be weight loss, there will be chances to get a diarrhea and myelosuppression. What is myelosuppression? Bone marrow suppression. So there will be chances of getting decreased platelet, decreased WBC and decreased RBC. Clear? Okay. So what is the sign of thrombocytopenia? Thrombocytopenia causes bruises, to tendency to bruise easily. So this is the answer. Fatigue, shortness of breath. First two signs are the sign of anemia. Second sign is included in infection, so it is indicating decreased WBC. Fine. Okay, so please mention the side effects of radiation therapy. There are common side effects, like you can just mention this: nausea, vomiting, weight loss, myelosuppression, and skin damage and diarrhea. And next question, nurse caring for a patient or a client who is receiving radiation therapy, which activity by the client indicates further instruction on the side effect of radiation therapy? Okay, I repeat. Nurse is caring a patient who is receiving radiation therapy, and which activity by the client indicate further instruction or further instructions, which means you need to teach further instruction, again and again instruction on a side effect of radiation therapy. That means the patient done or the patient stated for thing which of the following is indicating that further instruction is required. Okay, so that means the patient or a client did a wrong, or the patient performed a wrong thing from this four. Okay, so go through each and every options. Which one is indicating a wrong that requires further instructions? മനസ്സിലായോ? ഏത് സിറ്റുവേഷനിലാണ് നമുക്ക് further instructions വേണ്ടി വരുന്നത്? Further instruction is required when a person states a wrong statement or when patient does any negative things or wrong thing. Using an electric razor. Electrical razor is necessary to control bleeding or to prevent bleeding. So that is necessary. Eating high protein diet, even that is also necessary. And taking his children to see Santa at a mall, where the patient is taking their children into a mall where there is a crowded area, where this particular patient may develop infection. So which is a wrong thing. And calling the doctor for temperature of 101 degree. Yes, obviously it is necessary, because there will be chances to get infection. So at that particular moment the temperature will increase. So when patient develops increased temperature, yes, you need to call the doctor. Fine. And the next question, a man says to the nurse, I don't understand how my wife could have come down with cancer, and she does not even smoke and drink. How do people get cancer? Which of the following should be included in the nurse's response? Select the one or all that apply. So, a man or a husband of a patient is asking the nurse, even my wife is not drinking, or she is not having a habit of drinking and smoking. Why do people get cancer? And he wanted to know the causes of cancer. Okay, so which of the following should be included in the nurse's response? So when you give the correct therapeutic response, when you respond the patient, you have to be very clear that you need to include the causative or risk factors of cancer. So what are the risk factors of cancer? Basically family history, genetic thing, sedentary lifestyle, dietary changes, exposure to radiation, chemotherapy, and exposure to any of chemicals. Even the chemotherapy, it is considered as a choice of treatment, but still it might cause secondary cancers. Okay, for example, if a patient with cancer treatment chemotherapy receive in the patient, later on ഈ കീമോതെറാപ്പിയുടെ സെക്കൻഡറി ഇഫക്റ്റിൽ നെക്സ്റ്റ് ഒരു ക്യാൻസർ എപ്പിസോഡ് വരാനുള്ള ചാൻസ് ഉണ്ട്. ഓക്കെ, ഈവൻ ദ കീമോതെറാപ്പിറ്റിക് മെഡിക്കേഷൻ ഇറ്റ്സെൽഫ് ഇസ് സൈറ്റോടോക്സിക് മെഡിക്കേഷൻസ്. ഓക്കെ, so what are the risk factors? Yes, bacteria, helicobacter. So mainly bacteria, there are certain bacteria, Epstein-Barr, like Helicobacter pylori ഒരു reason ആണ്, and Epstein-Barr virus and HIV virus. Okay, and dietary factors, yes, high fatty food will also cause this, and genetic factors, yes. So ഈ പറഞ്ഞിരിക്കുന്ന നാല് നമുക്ക് കളയാൻ പറ്റില്ല. So the answer for this question is bacteria, virus, dietary factors and genetic factors. Clear? Do you have any queries regarding this? And I will upload further questions in the next video. Okay, thank you for watching. Bye.